Senator from Illinois.
Mr. President, I want to thank my colleague from Connecticut and my colleague from California for coming to the floor. You see, for the last hour, senators have come to the floor and told a number of stories about individuals and the difficulties they've run into with health insurance. And I don't dispute the facts that they brought to the floor, but I do dispute their characterization of what America faces at this moment in time. I supported the Affordable Care Act. I believe it was the right thing to do. I still believe it. I'll tell you right off the bat, and most Democrats and Republicans would agree on this part, it's off to a rocky start. This website that was supposed to be ready October 1st, we're told will be ready by November 30th. I hope it is, and the sooner the better. I'm told it's improving by the day. That's good. Americans need access to information about health insurance. And when they have that access, they can do something, for many of them, for the first time in their lives, go shopping for health insurance. You know, there are a lot of people who've never had that luxury. Some have never had health insurance one day in their lives. Others have been given a take-it-or-leave-it situation with a policy that may or may not be worth anything. I listened carefully to the Republicans for a long, long time on the issue of health insurance. I've heard a lot of criticism, a lot of complaint. They want to defund Obamacare. They want to delay Affordable Care Act. They want to destroy it. They don't have an alternative. Oh, we want to repair and replace it. Well, let's hear your proposal. We never heard one during the course of our debate on creating this law 3.5 years ago. We kept waiting for the Republican plan. The honest answer is they had none. And apparently they still don't. The reason they don't is they fall back and say, let the marketplace decide. Well, many of us know the marketplace in healthcare personally. We know a marketplace that has turned away 40 to 50 million people who are uninsured in America. People who still get sick, still go to the hospital, and whose bills are paid by everyone else. The Republican Party is supposed to be the party of responsibility and rugged individualism. What about the responsibility that we all have, if we can afford it, to have health insurance, and as a country to provide the means for those who can't afford it so they can have protection too? That, to me, is responsible. Trying to just stop this reform is irresponsible. When you get into the specifics on the Affordable Care Act, you never hear a Republican senator come to the floor and make a case against the specifics. You know why? They can't. Is there a Republican senator who will come to the floor and defend the right of a health insurance company to turn down a person or a family because of a pre-existing condition? That's the situation we faced when we passed the Affordable Care Act. Is there a family in America that doesn't have someone with a pre-existing condition? Most families do. My family has in the past and does now too. And pre-existing conditions can range from the very, very serious to things which are chronic and manageable, from asthma and diabetes to cancer survivors. The list is long. The Affordable Care Act says you cannot turn down a poor person in America for health insurance because of a pre-existing condition. The Republicans say they want to repeal that. They want to go back to the day where you can turn down a person because of a pre-existing condition. Then have the courage to come to the floor and say it. They won't. The law also says, you can't limit the lifetime payout on a health insurance policy. There were a lot of people who thought $100,000 was a lot of money for health care until they got into a serious situation. One diagnosis, one serious disease, one accident away from medical bills that would wipe out $100,000 in a day or two. So we put in the Affordable Care Act there can be an upper lifetime limit when it comes to the payout under the health care insurance policy. The Republicans say they want to repeal it. I challenge any Republican senator to come to the floor and explain that one. Did you know as well, Mr. President, that of the family policies sold in America, 60% of the family policies did not cover maternity benefits? We require the coverage of maternity benefits. Now, let me tell you, my wife and I are not in a situation where we're likely to ever use those personally, but we happen to believe that it's a good thing across America, and it's a family-friendly thing across America to make sure that policies cover maternity. Those who talk about family values and love of family and love of babies and children, why in the world wouldn't you want to include that protection in all family policies? Spread the risk across the population, but make sure every family can afford to have prenatal care for a healthy baby and a healthy mom when that blessed event arrives. I'm waiting for the first Republican to come to the floor and say that's a bad idea too. Incidentally, health insurance policies used to discriminate against certain groups, particularly women. We said that's over. You can't discriminate against women and treat them differently. You've got to be fair in the allocation of this risk, and you can't use gender as a basis for increasing the cost of a policy. The Republicans want to repeal that. I'm waiting for the first Republican senator to come to the floor and say health insurance policies, because of the free market, should be allowed to discriminate against women. That's a reality. The other thing we provided in the Affordable Care Act, finally, families with children coming out of college looking for a job can keep their kids on their health insurance policies to the age of 26. We don't know exactly how many are this. Some estimate 300,000 plus young people still on their families' policies. Why is that a good thing? Because a lot of young people coming out of college don't find a job right away. And some that do may not have a full-time job or benefits. If you've ever been a mom and dad, and I've been in that circumstance as a father, where I called my daughter and I said, Jennifer, do you have health insurance? Dad, I don't need it. I'm healthy. You know, those are things that keep you up at night. The Affordable Care Act provides additional protection for these young Americans who are just starting out in life and trying to find a job. The Republicans want to repeal it. I'm waiting for the first Republican senator to come to the floor and make that case. Oh, we should make sure that young people in their 20s don't have health insurance. That's the result if you repeal the Affordable Care Act. And what about senior citizens? Medicare Prescription Part D provides prescriptions so senior citizens can stay healthy, independent, and strong for as long as possible. And the problem we had, of course, was something called the donut hole. It meant out-of-pocket expenses seniors had to pay for those prescriptions. We are closing and filling the donut hole so that seniors aren't giving up their life savings in order to have the prescription drugs they need for a healthy life. They want to repeal that. They want to repeal the Affordable Care Act. I'm waiting for the first Republican senator to come to the floor and say seniors ought to pay more for the prescriptions they need under Medicare, because that's the result of repealing the Affordable Care Act. Now, let me just also say this. Life experience tells us several things. First, premiums on health insurance go up with some frequency. We're trying to slow down the rate of growth, but they've been going up for a long time. In some markets, for example, when it comes to individual policies people are buying, those have gone up rather dramatically, sometimes 15% a year for a long time. Secondly, in that market of individuals buying health insurance, 67% of those policies are canceled every 2 years. So now they come to the floor and tell us stories about premiums going up and cancellations. Can I remind my friends on the Republican side that's been going on for a long, long time. Now they blame every cancellation on the Affordable Care Act. They blame every premium increase on the Affordable Care Act. That's just not factual. It's not true. Let me tell you some mail I've received on the subject. Here's an email from a constituent I'd like to read. In Illinois, here's what this constituent writes. As a lifelong Republican, I am absolutely appalled by the extremists who have hijacked my party, and I'm thoroughly ashamed of all the attempts to defund President Obama's Health Care Act. Already, my medical costs have dropped due to early provisions of the act, and if it passes, becomes law, it appears I'll save $6,000 a year on my premiums, health insurance premiums. I realize that not everyone shares my enthusiasm for the health care bill, but I want to make two comments. When the act is broken down into its component parts, polls consistently show that American people agree with the program. Secondly, all I'm asking is that we give it a fair trial, give it a fair chance. Say 2 years. Of course it'll need tweaking and revising. But if it doesn't work, then we can repeal it after 2 years. Quite frankly, obstructionists are a public embarrassment to those of us who grew up with a different Republican Party that cared about people and was not mad